Today's medical-centric topic is pollen allergy, types, symptoms, causes, treatment, and more. Pollen allergy, also known as hay fever or allergic rhinitis, is a common condition that affects many people worldwide. Here's an overview of the different types of pollen allergies, their symptoms, causes, and treatment options. Types of pollen allergies. 1. Tree pollen. Common culprits: oak, birch, cedar, and pine trees. Season: typically in the spring. 2. Grass pollen. Common culprits: timothy, Bermuda, and Kentucky bluegrass. Season: late spring through summer. 3. Weed pollen. Common culprits: ragweed, sagebrush, and pigweed. Season: late summer through fall. Symptoms of pollen allergy. 1. Nasal symptoms. Sneezing: frequent and uncontrollable sneezing. Runny or stuffy nose. Nasal congestion or a running nose. 2. Eye symptoms. Itchy eyes. Persistent itching in the eyes. Watery eyes. Excessive tearing or watery eyes. Redness. Red or irritated eyes. 3. Throat and ear symptoms. Itchy throat. Itching or irritation in the throat. Ear congestion. Feeling of fullness or congestion in the ears. 4. Respiratory symptoms. Coughing. Persistent cough, often worse at night. Wheezing. Shortness of breath or wheezing, particularly in those with asthma. Causes of pollen allergy. 1. Immune response. Overreaction. The immune system mistakenly identifies pollen as a harmful substance and releases histamines to combat it. 2. Genetic factors. Family history. A family history of allergies increases the likelihood of developing a pollen allergy. 3. Environmental exposure. Geographic location. Living in areas with high pollen counts. Seasonal changes. Pollen levels are higher during certain times of the year, depending on the type of pollen. Treatment options. 1. Medications. Antihistamines. Help relieve sneezing, itching, and running nose. Decongestants. Reduce nasal congestion. Nasal corticosteroids. Reduce inflammation and relieve nasal symptoms. Eye drops. Relieve itchy and watery eyes. 2. Allergy shots. Immunotherapy. Desensitization. Gradually introduces small amounts of pollen to build up immunity over time. Long-term relief. Can provide long-lasting relief from symptoms. 3. Lifestyle and home remedies. Avoid pollen. Stay indoors during peak pollen times, usually early morning and late afternoon. Keep windows closed. Use air conditioning instead of opening windows. Shower after being outdoors. Removes pollen from your skin and hair. Use HEPA filters. Install high-efficiency particulate air (HEPA) filters in your home. 4. Nasal irrigation. Saline rinse. Use a saline solution to rinse pollen and mucus from your nasal passages. 5. Alternative therapies. Acupuncture. Some find relief from allergy symptoms with acupuncture. Herbal remedies. Butterbur and quercetin are natural supplements that may help reduce symptoms. When to see a doctor. 1. Persistent symptoms. If symptoms persist despite over-the-counter treatments. 2. Severe reactions. Experiencing severe allergic reactions, such as difficulty breathing or swelling. 3. Asthma. If you have asthma and your symptoms worsen during pollen season.